Scientists working for the government continue to get paid royalties from pharmaceutical companies, and many details of the payments are hidden from the public. Building on that work that Open the Books has done really for some time now, the third time, Senator Rand Paul has sponsored the Royalty Transparency Act to bring more transparency to federal public health sector. Joining us now is the OpenTheBooks.com Deputy Public Policy Editor, Rachel O'Brien, who's always here with us. Thank you so much for joining us. Now, we've talked about this before. Give us the latest on what your group has been able to collect when it comes to these royalties.
Yeah, good morning, Angela. So for years, we've asked for royalty information from the National Institutes of Health. So their government scientists invent treatments for disease, vaccines, and more, and then they license them to pharmaceutical companies who pay them royalties. So sometimes their institutes and centers get paid, like the National Institute for Allergies and Infectious Diseases or the National Cancer Institute. So we argue that the public should know which scientists are on patent licenses for which medical innovation, which private company is using it and for what, how much they're paying, so the public can understand if there's a potential conflict of interest. So we won 2 lawsuits, one in 2022, one in 23, to compel the NIH to disclose these payments. The first one, they gave us a total a dollar amount that scientists received between 2009 and 2021, but they hid the companies that were making the payments. The second lawsuit required the NIH to remove some redactions. We still don't know how much scientists receive individually. Really? So far we know $2.7 billion in royalties companies paid through 2023 to 2,600 government scientists for work that they did.
That's a lot of money. Many of these companies are buying licenses from inventions of U.S. scientists. They're actually in foreign countries.
Yeah. So I should note that most of that $2.7 billion came in 2022 and 23 following the height of the pandemic. So we can guess what a lot of that money was for. So we talked about this last year when we figured this out. There are now more companies in foreign countries, including China and Russia, that pay to license American technologies than there are American companies that are paying for that. So in 2023, there were 139 non-US licensees versus 102 American ones. So, this public research is used for profit, and it's the public's business to know how it's being used by who, especially if it's a foreign company.
Now let's talk about this Royalty Transparency Act. What exactly is it? What will it do?
Yeah, Rand Paul has been doing great work. This is the third time he sponsored this. It would require scientists to disclose their royalty payments, plain and simple. And any entity that applies for grants or contracts from the government, they have to disclose royalty payments if they paid them to government scientists in the last decade. Agencies would also be required to post financial disclosure reports on their websites. So this is the third time that this bill has gone through committee. It got a unanimous bipartisan support from the Homeland Security Committee last week. Both Rand Paul and Senator Joni Ernst, they spoke in the Senate about the work that our late founder, Adam Andrzejewski, did in bringing light to these royalties. Our report last August was the last published report that he oversaw before his death. So this is necessary. The American public health sector now has severe reputational damage, right? People lost trust in guidance from the NIH and the CDC. And this issue touches every therapeutic in the market, from cancer treatments to obesity management drugs to combating Alzheimer's disease. So, we're asking congressional leaders to finally give this a floor vote and pass it and get some transparency here.
All right, thanks so much. OpenTheBooks.com Deputy Public Policy Editor Rachel O'Brien, thanks for joining us.
Thanks for having me, Angela.